long's he been gone?
I don't know, 10 years?
Jeez.
I'd like to call the Board of Trustees, Indian River County Hospital District regular monthly meeting to order, 4 o'clock, November 20th. I'd like to start with invocation from Frank Isley.
If everyone could bow their heads, please. This prayer tonight is inspired by Psalm 91. Heavenly Father, we come before you with gratitude for the opportunity to serve our community and to do work that impacts lives in meaningful ways. Your word reminds us that those who dwell in your presence will rest under the shadow of the Almighty. Today, we ask for that covering, that you would steady our hearts and guide our decisions with wisdom, clarity, and courage. Protect this Board of Trustees and their family members, our partners, and those we serve from harm, confusion, and fear. Guard our county's caregivers, patients, and families with the assurance that no challenge is beyond your reach. Send your angels to watch over our hospitals, clinics, and community programs. Let this district help be a shelter of hope and healing for all who need it. Because we trust in you, Lord, we know you will guide us through every uncertainty and lift us through every trial. May all that we do today honor you and strengthen the well-being of those we are called to serve. In your holy name we pray. Amen.
Amen.
Republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We'll proceed with our consent agenda. We have approval of the chairman minutes from October 22nd, regular monthly meeting, October 23rd, and a November disbursement of $2,206.07.
So moved.
Is there a second?
Second?
All those in favor?
Aye.
We had yesterday the chairman's meeting and had very productive meeting related to several topics, one of which was the Indian River County Hospital grant opportunities presented by Jordan Flick of the Flick Framework. This excellent presentation by Jordan Flick relates to grant opportunities for the Indian River Hospital District with programs from the state of Florida and the U.S. government. She emphasized that the district such as ours is in a unique position with opportunities not available to most private or independent entities and stressed the benefits of collaboration. Our specialist, Sharon Cox, along with our executive director, Frank Isley, are positioned to work with Jordan Flick through partnerships with the Ferguson Group and others. Close relationship with our state entities is very important, including our representatives Bobby Bracken and Aaron Grau. We need to identify opportunities with them. In that regard, I would like to ask Paul Westcott, who is our government liaison, along with Frank Isley, to investigate and set up meetings with appropriate state representatives to pursue potential government grants. So as a government entity, we certainly have advantages to do so. Secondly, we had a very robust discussion and presentations from 4 entities regarding letters of intent to pursue our 10th Street property. Several commented that it was a strong strategic move by our district to buy this property and related facilities despite what was stated previously in the press. Representatives from New Horizons, Right Life, PRU Health and Wellness, and Thrive were present and presented their programs. The first was by New Horizons, a first responders mental health challenge and care for these first responders. Wellness Recovery Action was planned to advance behavioral health with a respite model to provide safe and supportive environment and triage as a guide for these individuals for the next phase of treatment. PRU Health and Wealth proposed substance treatment with detox, residential assistance, and intensive outpatient programs. They have a record of success in our county. Lastly, Thrive Leaders proposed a central intake and respite housing model with 24/7 access to anyone seeking help in substance abuse to avoid the crises which they face. Respite offered to start short-term stays and to provide a safe environment to stabilize these individuals with behavioral health issues and other challenges, prevent relapse and crisis risk. They reported that 26,000 residents, 1 of 6 adults in this county face these challenges, with approximately 2,600 indigent potential patients with behavioral health issues. They suggest we need a centralized entry point to assess and provide treatment. In that regard, at our next meeting in December, we'll discuss further these 4 presentations. I'd like to thank Kate Voss and trustee Karen Bartlett for their work, particularly on this 10th Street area, and ask trustee Bartlett to provide some summary related to the previous presentations to help direct our future discussions and decision-making regarding the 10th Street property. I'd also like to thank the Opioid and Substance Abuse Task Force, thanking them for their work beginning last March on this major health care issue, and its chairman, Meredith Egan. We continue to have very good discussions on these subjects, including the final one, the Board of Trustees, which we'll review tonight, our Indian River bylaws with action to approve at our next meeting. Thank you. Ooh,
Chairman Cooney, could I ask for clarification?
yes,
You want me to provide a summary of the, or
I'm
Karen?
sorry, I meant Karen to do it.
You, okay, you had Karen and Bartlett, and so I was confused.
Sorry, Karen.
And for the record, since this will be in the minutes, I think it's pure health and wellness?
Yes.
Okay, great. Thank you very much.
Okay, I'd like to call on Jennifer Pesky for the District Council's report and remind us of conflict of interest.
All right, thank you, Mr. Chair. Again, as our chair just alluded, our monthly meeting packets now contain a copy of Form B, which is our statutory memorandum of voting conflict. So if a conflict does arise during a meeting where a trustee needs to recuse him or herself, we'll do that in accordance with our conflict of interest policy and fill out the attached form. Our attorney's overview is also included with each monthly meeting packet now, which summarizes our best practices for how we handle our meetings as well as public comment. This month's been another busy month working with the district. We just completed our work on a draft bylaws amendment for the 2025 amended and restated bylaws so that the bylaws will be consistent with new policies adopted and any other updates or changes we identified during this process this past year. And we did discuss these yesterday at the monthly chairman's meeting, so I'll be back to have your approval, a request for a motion for approval rather, on those documents under unfinished business, and those are before you. We did correct the 2 things we identified yesterday, clarifying the vice chairman, titling that correctly, and also we incorporated the language on page 22 with regard to the conflict of interest policy and our practices there. So that's now been incorporated. So if those are approved tonight, we'll have our secretary, Ms. Deagle, sign those after the meeting, and that will be done hearing about bylaws for some time now from me. The other thing we've been working on is bringing forth for your review and approval next month a proposed lease addendum by and between the district and VCOM for lease of the Human Services Building. We did grant them an extension at the October meeting until approximately January 9th to adopt this, so we'll be bringing this back for your review next month. We're also still working on the matter with regard to the VNA's request to connect to the retention pond on the land that we lease to the hospital. We did have a meeting November 12th with some of the representatives at the VNA to get a little bit more information, and we'll be bringing back more information to you on this matter as well next month before any other action would be taken. Following the August 3 town halls within the community, we also were able to resolve a maternity funding agreement this past month. Everyone should be congratulated for their efforts in that regard, and the continued maternity services that are now going to be continuing in our community as a result of all of that hard work and effort. And then last, we've been working closely this past month with both Dawn and Shannon in the district office regarding reviewing and finalizing 3 policies for your approval. At this time, we did review the following policies, including fraud, false claims, cybersecurity, and a standalone whistleblower policy. And all 3 of those policies did come before you yesterday at the chairman's meeting, where we had a good discussion on that, and those were all approved and adopted. Are there any questions I can answer at this time?
Mr. Chair, if I may, we were going to insert Mr. Pickering.
Yes, that would be fine. We'd like to change the agenda a little bit by asking Jeff Pickering Indian River Community Foundation to tell us what the results are of the community needs assessment. Jeff, welcome.
Great, thank you. Mr. Chairman and trustees, thank you very much for the opportunity. Thanks for moving me along in the agenda. I've got to be 2 places at once, as I'm sure you all probably do on occasion. I have a presentation and I have a script, so I'm going to try to stick to it in the interest of time. I know you've got a packed agenda. We're getting queued up. Well, you all know me, but for the members of the public, my name is Jeff Pickering. I'm president and CEO of Indian River Community Foundation. Our mission is building a better community through donor-driven philanthropy, and with our clients together, we've awarded more than $150 million to charity, mostly here in Indian River County, and our balance sheet stands at about $130 million. In addition to helping generous philanthropists in awarding grants to local charities, one of our most important strategic priorities is to develop and share knowledge about Indian River County's needs and the effect of charitable organizations meeting them and that merit financial support. So today I'm pleased to share the results of the most recent effort, the 2025 Community Needs Update. And I'm going to attempt. Well, we started this effort back in 2019. You all are aware of the effort we did there. It was a 12-month research project that involved an independent research consultant, 6 community funders, 50 local charities, 12 in-depth focus groups, and more than 1,400 survey respondents in English, Spanish, and Creole. And the project assessed the needs of children, adults, and seniors, and focused primarily on the domains of health, education, economic opportunity, and housing. You can scroll down, Jeff. Perfect. There we go. All right, great. One of the things that we wanted to do was share, overall what many of those efforts returned, which was we have a growing population, we have a diversifying population, we're making progress in certain areas, 2 being infant mortality and the reduction of that, improvement in grade level reading, but there are some significant persistent problems, most significantly poverty in our community that really has an effect on all the work that we do. In an effort to really try to simplify the work that goes into studying data and information, we published Indian River Indicators, which is a community needs database. It helps answers questions about where we're making progress, which organizations and proven programs need to be scaled up or sustained, where we're not making progress, and which promising practices might need to be developed to address gaps. Now, onto the study. It was sponsored this year by the Corbett Foundation, the Community Foundation, and the United Way, and it was conducted in collaboration, mostly on the data side, with Indian River County Hospital District and the School District of Indian River County. The methodology included 2 perception surveys, one of which you're familiar with, done by Clearview Research in January to assess healthcare needs and perceptions, and then subsequently in February to address overall general needs and perceptions. And finally, it culminated with a comparative data analysis going all the way back to 2010 to today. And what we found is the results of both the perception studies and the data were that 2/3 of the population believe the quality of life of Indian River County is headed in the right direction, and that includes, as you know, the quality of healthcare services. Now, despite this relatively high level of satisfaction, Excuse me, there we go. There were some specific areas of concerns. One being healthcare access and affordability, quality, accessible, and affordable childcare and early education, low wages and the limited transportation to get to and from good jobs, housing affordability, and public safety. Specifically, in the public safety area, concerns among Black residents about violent crimes in their neighborhoods, and then overall concerns about residents of the infrastructure related to traffic and pedestrian safety. Now, before looking at the overall trends that we found, we'd like to share a couple of outlier observations. The first falls into the category of infant and maternal health and the importance of local maternity services. As you know, after a perception survey and several town hall meetings, an overwhelming majority of residents believe the local maternity services are a necessity for public health and also essential to Indian River County's overall well-being. We're also pleased to learn that there was strong support for the use of public dollars, taxpayer funds, to keep these services in our community, and as Ms. Peschke just stated, we had a successful result in making a commitment to continue labor and delivery here for some time. Another outlier observation was the perceptions around K-12 public education. In the general survey, we found that 2/3 of the respondents were satisfied with K-12 public education. However, 1/3 were not. Now, if you split that 1/3 down the middle, half of those are folks who have no kids, no grandkids, and maybe no interest in the schools, but the other half are people who do. Now, this is in a school district that has achieved an A rating for 3 years in a row. It ranks 5th out of Florida's 67 districts, and it's been led by the Superintendent of the Year last year and one of 3 national finalists for Superintendent of the Year of the United States. Despite our best efforts as a community to improve quality, to engage parents, and to offer more choice, we still can't seem to please everyone. And then finally, a new face of homelessness in our community. While the 2025 point-in-time survey conducted by the Treasure Coast Homeless Services Council reported the lowest number of homeless people ever in its annual one-day count, that was 198 people, both adults and children, the number of students who reported experiencing homelessness at some point during the school year was the highest ever at 655. These are kids who are attending our public schools and spent at least one night doubled or tripled up in someone else's home, in a shelter, in a car, or sleeping outdoors. And the fact that most of these students were missed, they weren't around, they were somewhere else on the annual one-day count, it speaks to the absolute resilience of the families that are willing to do anything to ensure that these episodes of homelessness are brief. When it comes to demographic trends, much of the same. We've continued to see growth, population exceeding 170,000, 40% of the residents male, 52% female. 73% are white, 27% people of color, again with Hispanics being the fastest growing race and ethnicity. 34% are seniors, aged 65 and over. That's almost twice the Florida average. And then 2 other areas where we were higher than the Florida average, 17% were disabled and 10% veterans. And now on to the trends. Let's start by taking a look at health, much of which you'll be familiar with. There's some promising health trends that we found. At the high level, there are more yearly checkups taking place in our community, largely as a result of the work that you've funded and that's being done through our community healthcare centers. We've seen, in many ways, improved healthcare provider ratios, although sometimes it doesn't feel like it when you're trying to call and get a doctor's appointment, but the numbers do speak for themselves. We've seen improved infant mortality and then overall decreased risky behaviors such as alcohol and drug use among adolescents and teens. Concerning health trends continue. One is in the area of high-risk pregnancies. Despite our progress, 30% of the pregnant women in our community still receive no prenatal care in the first trimester. We've continued to see persistent struggles with mental health. Adult hospitalizations for mental disorders were 60% higher than that in Florida. And then high rates of food insecurity, not just counting the last month of government shutdown. Prior to this, 72% of households with children in poverty do not receive SNAP benefits. And then 50% of seniors live more than 1 mile away from fresh foods. If you've ever had the opportunity to do a ride-along with the Meals on Wheels program, going down one of our dirt roads to the end where there's a shack, maybe propped up on cinder blocks, and walking inside to see a 90-year-old senior citizen who's dependent on that meal, you know that they're not walking or driving to a local grocery store. And if they could, it's going to be more than 1 mile away. Next, in the area of education, we've seen improvements in the area of preschool enrollment. We've seen improved reading proficiency, improved math proficiency, record high school graduation, and fewer dropouts. In terms of some concerning education trends, 44% of our students still arrive in elementary school unprepared for kindergarten, and 32% of public school students are considered chronically absent, missing 10% of the school days in a year or more. And that is the average for the state. There are counties that are way worse. So if you think about that being not just a local problem, but it's a problem across the state and across the country. In terms of trends in the area of economic opportunity, there's really only one to speak about when it comes to promising economic trends as of late. We've seen a higher level of median household income, and it's risen to $72,000 annually, and that's driven mostly by higher paying jobs that are professional jobs in the areas of finance, insurance, and many of the areas that you care about, thanks to Cleveland Clinic, Indian River Hospital, and the community health providers in the areas of medicine. Now, in terms of concerning economic trends, we continue to see more people in poverty, a growing ALICE population, although this year there's been a slight decline with the report that just came out in the last couple of weeks. When adjusted for COVID, leftover funding, and perhaps the increase in median income, we're not so sure if that's a trend or if that's just a blip, but it is worth mentioning. We continue to have too many economically disadvantaged students who show up needing to learn, but not necessarily having the resources to do so. Overall, low wages, and then an unemployment rate about 1% higher than the state of Florida at 4.7%. And finally, let's take a look at housing, a topic that seems to be on everybody's mind, not just here, but across the country. Now, I did mention, and it's somewhat confusing when you look at the positives, we did have a lower point in time count on one particular day. I think when you compare that to the number of homeless students, there's some more work to be done to understand those statistics. I don't think the homeless situation is getting any better. It's just changing. But also we saw reduced domestic violence over time, thanks to organizations like Safe Space and other awareness, keeping people aware of the services that are available to escape those situations. In terms of housing trends, we've seen the highest number of homeless students ever, as we talked about. We're continuing to see more evictions. More housing costs burden owners and renters, where in this community, 50% of our renters are paying more than 30% of their income for housing and housing-related expenses. That's untenable. And then senior isolation, the seniors I mentioned that live alone or far from friends or family or other support networks. To wrap up, we've made some observations and recommendations, and these are really important, especially for those organizations like ours and yours who are responsible for stewarding public dollars or private philanthropy. A solutions-oriented framework is needed to practice community leadership. We believe that this requires things like reviewing additional data, as we did several years ago when we had one of the highest infant mortality rates in the country and began the practice of reviewing those statistics, and that had some contribution in our rates going down. If we're gonna make change, we have to look at additional research, as we're doing now, to evaluate the impact, and economic impact rather, and the quality of early childhood education and the workforce that goes along with that in partnership with the Florida Chamber of Commerce and Child Care Resources. Creating change does require us to engage a diverse representation of community residents, as we're doing and have been doing to increase third grade reading through our Moonshot Moment Literacy Initiative. It requires working across sectors, as the City of Vero Beach is doing through a public-private partnership to prevent economic and environmental disaster for low-income homeowners through a septic-to-sewer conversion project. And as our arts and cultural organizations like Ballet Vero Beach, Riverside Theater, Vero Beach Museum of Art, and Vero Beach Opera are doing to make arts accessible to everybody. Finally, also, it requires us to marshal resources, as you and a hospital provider did to save a failing public hospital several years ago. It also requires the bold courage to look at public policy, either public policy that really is not serving our community's needs or those that don't exist that we might need to create. Those are all the elements when we get involved in solving problems that the Community Foundation is really encouraging people to pay attention to. It's not a one single-stop solution. It requires an all-of-the-above strategy. Another observation and recommendation we have is that we have to understand where the financing comes from. In our community, our marketplace, we've got over 800 501c3 charities. 200 of them, roughly, earn $50,000 a year more and are required to file an IRS 990. The nonprofit sector is responsible for 5,200 jobs, about 10% of the jobs. Most of them are in the health space, another 31% are in human services. But they generate wages of about 11% of the wages that are earned here in Indian River County at $268 million. So it's an important part of our community's quality of life. It's an important part of our workforce. It's an important place to invest resources. In terms of income and expenses, total revenues generated by those nonprofits were $384 million. Contributions took up 41% of that. Individuals like you and me sitting down at our kitchen table, writing checks, making stock gifts, going to our donor advised funds and making grants. That was followed by earned income, the sliding scale payments that many of our healthcare providers or other organizations like Boys and Girls Club may charge for kids to come and attend after school, represented 39%. At 15% is where government support comes from, and this is something to think about in terms of the dollars that you are responsible for stewarding. Of the $58 million, only about 20 or so of that is funding that is locally generated. So it's a precious commodity that you oversee with the roughly $15 million that goes out into our community through the hospital district every year. More importantly, it's one that can't go away. And then finally, investment income going forward. Now, when problems arise, generous donors are likely to continue to respond, but despite this hopeful source of support, philanthropy is not an adequate replacement for the efficiency and reliability that public dollars provide to operate systems that so many of our communities depend on. And the last piece that we wanted to look at is just to continue to encourage civic engagement. And when I look back after we just celebrated our 100-year centennial, it's hard to imagine the dedication required by the early settlers in this community that took the process to turning a hot, humid, sandy, mosquito-infested place into the county it's become. If we look at just the last 10 years, civic engagement is responsible for some big things that have happened in our community. There are plenty of examples. A community hospital was saved, a public school district was turned around. Dozens more acres of shoreline have been preserved to protect the Indian River Lagoon. Arts and cultural institutions are thriving and reaching a broader audience, and there are many more. During the same time period, however, the community's strong tradition of civic engagement has also frayed. Despite national recognition of excellence for our Supervisor of Elections office, voter turnout year over year has ebbed and flowed. Ballot measures to sustain critical programming for local children have failed. Federal and state mandates imposing costly requirements for our local health, education, and housing systems have gone unfunded, and iconic servant leaders like Dan Richardson, Alma Lee Loy, or Joe Idolette Jr., who was honored yesterday by the County Commission, they're gone. There are plenty of community needs that cannot be addressed by one person alone. And so for the community, we're saying that whatever inspires you to give or get involved, we implore you to give and get involved. The future of our Indian River County community depends on it. And thank you. If there are any questions, I'm glad to answer any. Otherwise, I've provided copies of the report to everyone, and there are references available on the Community Foundation's website.
Thank you very much, Mr. Pickering. Are there questions?
I'm going to ask a question that actually, I think the answer is probably going to be pretty obvious. It's been on my mind past few months, and that is our middle class. And I think it was one of the 4 pillars, columns that you looked at, and that is the what advantages, benefits if our community was focusing on quality jobs? And I'm asking that question because I know it is a headwind for our hospital with the patient composition. Just for the sake of our benefit and the public, those who may be out there, if we focused on economic development, looking for quality industry, quality jobs, how would that improve the work that you're doing, the work that we're doing, and so many other organizations are doing?
That's a great question. We can take a look at almost any industry and look at how quality drives overall benefits to the community. One that we took a look at and will be continued to we're looking at in this year to come will be in the area of the early childhood education workforce. And what we look at in terms of that workforce is that many of the programs that are provided in our community are the reason why people are able to go to work. And without that childcare, especially for the young 0 to 5-year-olds in our community, some folks are limited. Maybe one person has to stay home or both people choose to stay home. And the issue why I'm bringing it up is it relates to quality. In order to have quality early education, we have to have the resources to provide those services. Right now, the state distribution for each child in early child care education right now is about $2,500. But for a 0 to 2-year-old child, it costs on average about $18,000 to provide quality care for that person. So looking at our industries and understanding where public dollars are allocated and where they may be short, and using data and information and research to understand that investing in organizations or systems like early education have more than a single bottom line effect. They have ripple effects across the community. I think we could do that with almost every industry and look at where we have just a JOB versus a quality job. Those that deliver multiple benefits are worth investing in, and those that aren't probably should be considered differently. Thank you.
Other questions?
All right.
No, I'd just like to say thank you for what you do for the community, you and the Community Foundation.
Thank you. It's a privilege to do it. It's incredibly hard work. I had some big shoes to fill, but more importantly, we've got an engaged and invested board of directors and clients and folks who really believe that this community is worth keeping, it's worth maintaining the quality, and it's certainly worth investing in. So it's something that our team looks at every single day when we come to work, so I appreciate that. Well, thank you all for moving me up on the agenda. I appreciate it, and thank you all for the work that you do as civic leaders in our community. Thank you.
Jeff, a question, I'm sorry, I
yeah.
should have asked it earlier. Are there extra copies of this?
There are
that we-
plenty of extra copies. I
Okay.
can go ahead and make sure that through Kate or others, we can get more delivered. So, and if you'd like them specifically for a different purpose, you can call our office on the back, and the number hasn't changed.
Yeah, there's just a couple of folks I've been thinking about hearing this that I would love to share this with.
Absolutely, yeah, the office has endless amounts of
Great,
copies.
thank
So, thank you.
Thank you.
Thanks much.
On to your next meeting, Jeff.
One more, two more.
Okay, two more. Let's now turn to our treasurer, Michael Kent, giving us a financial statement review.
Thank you, Mr. Chairman. In reviewing the first month's finances for the district's 25-26 fiscal year, I'm very pleased to report that our financial situation continues to be very strong. The financial packet you received includes the full set of financials for October, but to review the financials, we'll start as usual with the last 4 pages in this section, where you'll find 4 pages from the end, the 1-page investment and cash snapshot, which is always prepared monthly by Mr. Isley. At the top of that page in landscape, you'll see that at the end of October, the district had received $148,335 of ad valorem taxes, which represents 0.7% of our budget. As little as that might seem, it's about $35,000 more than October of 2024. But the reality is property taxes have just recently gone out, and based on historical ad valorem tax receipts, I would estimate that we'll have around $8 million by the end of this month, when I report a month from now. And we'll probably have about 90% of all of that budgeted ad valorem tax by January. Moving to section 1 on the snapshot, you'll see the district's U.S. Treasury holdings. On October 31st, our T-bills totaled $4,094,212. You can see there really are only 2 now. The maturity dates on those 2 existing T-bills are staggered monthly and are currently earning an average interest rate of 3.719. We talked about this briefly at the Finance and Audit Committee on Tuesday, and just reflected on the fact you're even used to seeing several months of T-bills stocked up, and they will be very shortly. That money comes in and is invested as properly as we can, and it's earning interest for us down the pike until we need to draw down those dollars to pay our bills, like in the month of October and November. Section 2 details the district's holdings in our preferred deposit pool. That's just a money market account. And you'll see that at the end of last month, it held $3,218,893, and it was earning at 4.01%. And the third section shows at the end of October, our local operating account at Seacoast was holding $588,020. You might have noticed, if you pay sharp attention to this document, that there is a third account listed at Seacoast for the first time, and I'm going to ask Mr. Isley, who did so effectively explain that at the Finance and Audit Committee, to give you an explanation of that new account.
Sure, happy to, Mr. Kent. So we wanted to, so a couple changes. The first is that we upgraded all our accounts, and so we were able to pay our community partners and make the disbursements through ACHs, which means once the trustees today approve these dollars, I will push some buttons and send payments out electronically to our community partners, and they will have their funds within a couple days versus 7 to 10 days. And as part of that, I wanted to minimize the balances that we hold in our deposit and our operating accounts until I have to put dollars in there. So in addition to our Florida Fit preferred deposit pool and our U.S. Treasury holdings, we opened up a high-interest money market account. You'll see that new account ending in 3401 on the third line with $243,000. Now, the Seacoast, working with us, was able to give us a very good interest rate for those dollars. So we have no minimum balance, and we receive the federal funds rate minus 0.25%. So just to give you an idea, for the past week, it's been about 3.63%. So I'm going to keep the balances in our deposit and operating as low as I possibly can, invest as much in the long term at the best interest rates I possibly can, and any remaining balances that we have to keep liquid in our account, I'm going to keep in this high interest account. So ultimately, the goal is to maximize our interest income with the tax dollars that we receive, especially since everything's front-loaded. But we're really going to try to optimize it this year.
Thank you, Frank, appreciate that. Altogether, on this sheet, at the end of the first month of our current fiscal year, you'll see that the district's investment in cash holdings totaled $7,901,125. If you turn the page, we'll be 3 pages from the end, and that will start the year-to-date expenses versus the budget. This is a spreadsheet that I compile. As you know, beginning this fiscal year, all of our funded programs are reimbursed on a fee-for-service model. But still, to assist us in tracking how the district's funds are being paid out, I'm going to go ahead and continue to show what a 1/12 percentage based on the month of the year is, just to give us a sense. It creates a marker that can help us gauge. But it goes without saying, with this fee-for-service reimbursement, there's just going to be more deviation than normal, and you're hardly going to ever see anybody that's precisely on, like Healthy Start Coalition, always every month for every program. As we get into the new fiscal year, I did want to say, though, both staff and I will be monitoring, the deviations in an attempt to stay ahead of any potential budgetary issues. Looking at the first month, there are some folks that are already 2 months into their money. That's going to deviate, and I will say the obvious, which is we routinely, in the 3 years I've been here, and I imagine for many years prior to that, in the last 3 or 4 months are going to have agencies that just are seeing more clients. There are going to be more contacts that are doing the fee-for-service work that we ask them to do, and will have to come back to us. But that's usually always going to follow on a conversation from Jenny or Shannon or someone, because they're monitoring that as well. With all of that, I did want to point out a few changes in this spreadsheet from the prior years. For example, all of the expenses, a little thing, all of the expenses in the report are arranged, ordered from the expenses in the P&L statement. So it's a little thing, but they track directly if you happen to cross-check the actual monthly P&L. And you'll note right at the top, the first 2 entries in this spreadsheet are for the low-income pool payments, LIP. They're no longer included within TCCH and whole family health agencies. We actually talked about that when we were creating the budget. And additionally, you will see the $2 million for maternity sustainability included under Cleveland Clinic. And under TCCH, you'll see the $250,000 capital campaign contribution. Year 2 has been included in that agency's data. If you move to the last page in the middle, you will see that the total for all program expenses at the end of October was $1,946,688, and that represents 8.8% of the approved total program budget. And then the bottom half of that last page, obviously, as in the past, lists the district's administrative expenses. And there you'll see total admin expenses through October 31st totaled $111,264, which is 7.4% of the approved budget. Combined, total program and admin expenses totaled $2,057,952, which is 8.7% of the budget that we approved. So we're actually out ahead a little bit of that 8.3. It's going to be what it's going to be, and we will always track it. Finally, as a point of comparison, at this point, last fiscal year, our total expenses were $1,475,586, or 8.6%. Before I move on to an action item recommendation from Finance and Audit Committee, I'll stop and just ask relative to either of those reports if the trustees have any specific questions that I or staff can answer. Hearing none. Lastly, Tuesday afternoon at the Finance and Audit Committee, and I'll start again, read what's on the paper. Lastly, yesterday afternoon, Kate forwarded you a resume for Catherine Katie Kirk. We have a couple open positions on Finance and Audit Committee, and Katie was initially suggested by one of the members, Susan Chenault, a month or two ago. I know Katie myself pretty well, and all of the committee members reviewed her resume. We think that she would be a wonderful addition to our committee, and based on their action, I would like to recommend that the Board of Trustees approve her appointment formally to the Finance and Audit Committee. Just for your information, we have another possible committee member who's meeting with Frank tomorrow, an initial conversation. So we may be filling another seat within 1 or 2 months. So formally, I guess, as chairman of the F&A Committee, I'd like to formally move the addition of Catherine Kirk to the Finance and Audit Committee.
Can I ask a question, Mike?
Yeah,
Not about Katie, but I'm sorry to ask this question.
Yeah.
Remind me who is on the committee currently?
Current members are Frank Schlitt, Susan Chenault, me, Frank, Keith Morgan.
Okay.
And we've got technically 2 open seats yet, but we lost 2 at the same time, and we're moving to fill all of them if we can. But when we talked about it, I guess 2 months ago, whenever we talked about it.
And do we have any obligation, either through prior practice or law, rule, whatever, to post any of these positions? In other words, is there any obligation for any sort of notice or anything like that? Yeah, okay.
That's a fair question, and it's not anything we've done, but the reality is it could be done. Yeah, no, God bless them, and it's a good group, and actually, just had a discussion at another meeting where I'm a little remiss in that this is a committee that for the first year at least met on a monthly basis. That's when we were creating specific finance, accounting, and operation documents so that we had guidelines that did, some existed, some were informal, but I mean, we were meeting monthly. And then we went to an every other month meeting. We always look at the financials. We're talking about the same documents that I've just spent some time with you, but they're not living this on a daily basis, but they get the documents on a monthly basis and have questions. And every time there's a new member, we kind of back up again and go some things that is a reminder to some. And lately, and the Finance and Audit Committee, as we know, the public may not, it's the only committee that exists at this point in time of the Board of Trustees. Well, that's not technically true. There's an integrity committee, there are some things relative. But in terms of operational committees, it's the only one we have. So one of the responsibilities that it's taken on for some, but not all policy documents that Dawn's been working on, Dawn, Shannon, and others, we've been kind of reviewing them before they come to you. And in fact, we spent 2/3 of our meeting on this past Tuesday, really in the weeds on them. And some do have very definitive relevance, like the reserve policy. Some are a little stretched or outside of the scope, but it all needs to happen. It's a good group that's willing to do what it takes. I'm rambling, I know, but that's the essence, and I didn't finish the thought. I've been remiss in not, on a more regular basis, saying, you know, we just had a meet, it's always the same week or just the week before, to talk a little bit about that committee, remind you that they're active and what we're working on at any given moment.
I fully support Katie Kirk becoming a member. Longtime friend, colleague, campaign co-chair.
That's right.
So glad she's willing to join us.
And I actually haven't talked to her. Kate had a conversation with her. I think she liked her personality.
We need a formal,
We've got a motion and a second. I'll call a question.
all those in favor of Catherine Kirk joining our Finance Committee, please say aye.
Aye.
Opposed?
Thank you. And with that, Mr. Chairman, my report is concluded.
Can you give us an example for the public and for us of what you most recently discussed? I think you mentioned it earlier today. Just one subject that,
Steer me.
hear you, I can't remember it exactly, but you said you spent a lot of time reviewing our documents.
Well, we spent a lot of time in particular on the reserve policy. It's an issue that we have talked about and been very vague about, to be honest, in some regards, but we've honed it down, we've tied it down. That'll be coming to you for approval. We also were talking, help me, Dawn, the procurement.
Internal
fraud.
audit policy
Yep.
and the purchasing and procurement policy.
Another thing crossed my mind here, as long as I'm rambling. We were talking about the investments with both now at Seacoast, which is very short-term, but when you're turning over millions of dollars and are losing even a few days of interest, it adds up, so it allows us to not have any gaps. But it's been a while, but somebody said, so why are you playing with the public's money? I said, we're not playing with the public's money at all. Number one, the millage rate is discussed, it's open, you have an opportunity to speak to it, but once that budget is set, we know what we're going to get based on figures that were given by the county. After that, most people who receive their property tax bill in Indian River County, the vast majority, pay it early. So as those dollars come in, I said, we'll probably have $8 million by the end of November that come to us. The statute for special districts is very specific about what we can do. We not only should, I mean, it's our fiduciary responsibility to take this money seriously, but to also grow it. The better we grow it, the less we're going to need in terms of any increases. But somebody had the sense that we're playing the market. There are very limited, and they are prescribed, avenues for us to pursue that investment. Hence, T-bills, U.S. T-bills, and money markets through the government. They're absolutely secure. They're not situations where any of the principal could ever be lost. And that came to mind because it came up, so I just throw that out. So, but that's the kind of stuff when we have a new member, Katie, may be asking about, okay, talk to me about Deep Blue, so she understands a little bit more. It's hard to sit down and give them the statutes for the establishment of a district and expect them to understand it all, so I'm done rambling.
Thank you. Thank you.
Thank you, guys.
Okay.
Katie will be a good member.
Let's move ahead now with the Executive Director report. Frank Heisley.
Thank you, Mr. Chair. Trustees, you have my report for October. Several of the items that Ms. Peschke mentioned, we worked on a lot of items this month, so I rather take this time, she covered a lot of them. So I want to take this time to have the staff present some real exciting work that they've been doing over the past several months. And you're seeing several of these things for the first time, and it's pretty cool. So let's start. Why don't you just start, Jennifer, if you could, please, just kind of walk through our,
Well, what you have in the packet from me is the proposed timeline for our next, or for this fiscal year, 26, 27, next fiscal year, I should say, application for funding timeline. So I've kind of outlined the process as far as starting with the letter of intent phase, and then moving in, that will start in January, and then moving into the actual application phase. Again, this will be through EC Impact. And then I've outlined the staff and trustee review time phase, and then also the proposed dates for our discussions. And, I give this to you now so that, you can place them on your calendar, have them on your calendar, know that those are gonna be the proposed meetings. They're subject to change if we don't need all of those, but I know this year it was kind of hard, to set another meeting if we needed it. So I'd like to just put some dates out there and have you at least pencil them on your calendar and tentatively, and then we can move along. The other thing is that the trustee evaluation survey did go out. I know it went out through Google Forms, and I have heard from two of you that had trouble getting into them, so I apologize for that. We tested it, it worked fine, so I'm not sure if it's just a glitch on your computer, but I do have a hard copy if you would like to fill it out that way, and then I can input the results into the system, and then we can get the results. And then the community partner evaluation is going out tomorrow to all of our community partners, and they'll be returning theirs also in December. So I wanted to try it out with you all first.
so we really wanted to ensure that we built our calendar for the year, for this next fiscal year, around the funding cycle first and get that established, and we would build the other items around it so we can get a jump start on it this year. What are we, Jenny, 3 weeks early, month?
Yeah, it's like about a month early.
Yeah, so we have a schedule presented already.
So this timeline comparative to last year is about a month?
Starting about a month earlier. I think we
Earlier.
started mid-February last year. But we want to give the LOI, that was kind of a new process last year, so we started a little bit late and didn't really give that much time for the LOIs, so we want to give an ample amount of time for those this year.
So I know that you're receiving from the trustees comments from this last cycle, and then we're also will be receiving.
Yep.
So you've set this up, obviously everything is subject to change, because if there were some processes that are going to change because of
Right.
feedback,
Yeah.
this
Of course.
could
Yes.
then
Of
be.
course. We wanted to present this to you just as a framework. It's tentative. Of course, we'd like your approval and we could do that after we get the feedback.
But I think we built in the timeline also for you to get the results back from the survey, so we have time to make those adjustments.
So then going forward, my understanding was that we were going to meet in February?
We're in the last week of January. We're looking
Is
at.
that too late, that
February.
if you're already going out for LOIs and all of that, should we talk about maybe having conversations about the funding process?
Sure.
Earlier than that?
Sure.
I am just,
Well, I think
timing
when we
wise, I
get the
don't know. What
results,
does
we'll be
everybody
able
else
to
think?
make that, hopefully we can make that adjustment if needed, but yes.
It's tricky because we didn't want to have scheduling, or our strategic planning and those discussions. The first week of January was going to be tricky because ideally, we'd like to do it as soon as we can in the new year before the LOIs go out.
Right.
So again, this is just a template. It's a framework. We're putting some dates on paper, but of course, it's subject to change, to your point.
Additionally, I'd add, is mic on? the chairman's meeting yesterday, I mean, we've had discussion about the fact maybe we need some longer sessions or more sessions at different times of the year. So, I mean, there's a lot of variables in play here, but we'll work it out, make sure it works and works to the best for us and for our partners.
The end of January meeting, did that happen after I left the meeting yesterday, talking about that? I'm in the dark about
I don't remember.
the meeting you just referenced.
The meeting that I referenced was something that we had been discussing. I think it's just maybe when Frank and I have met or whatever, that we knew that we were going to get feedback, as we all knew. We were going to get feedback from everyone, and how is that going to be disseminated, and, you know, how.
The impact on.
What's
on
the impact going to be on it? And
Right.
so there was no defined set meeting. It had been mentioned to me maybe, February. That's why I was just.
Okay.
And of course,
So no,
Carrie,
nothing
we
happened.
coordinate on that, but Jenny sent out the trustee feedback forms, was that a week and a half?
A week, yeah.
A week ago. So once we gathered that, we were going to share it with the trustees and then talk about when we were going to do our meeting.
Okay.
Yeah.
And what's the deadline for the partner? When,
I have a December 12th, I think. Is that Friday? December 12th.
12, okay,
It gives them 2 weeks.
Yeah.
2 weeks to complete.
okay.
Okay. Next, Dawn, if you could, please.
Yes, thank you. So I am obviously, in audit season right now. I wanted to tell the trustees that I have completed 6 on-site audit visits, and I just sent out the first 2 audit reports that were completed to the trustees earlier this week, but one for Hope for Families and one for Camp Haven. The cycle was definitely a lot faster this year, which was great. And I credit that to having Shannon to assist me with audit work and prep work, and actually coming out to some of the site visits and helping with the selection process. So it's been going great so far. And I would say probably about every 2 to 3 weeks, you'll see probably 2 audit reports come in. I feel like sending more than that might be just a little bit overwhelming, so I think 2 at a time is pretty good. You'll see the new format. They all have that financial summary on the back page that was recommended from our performance review. And I'm happy to answer anyone's questions on either one of those audits. If anybody has any questions now or in the future, you can just send me an email. So, thank you.
Now, if you remember, it seems like ancient history, but 2.5 years ago or so, we talked about the performance review, which we have to report to the state every 5 years. And so we haven't talked about it at meetings, but that doesn't mean that work has not been done. And so Shannon's going to provide an update on the work that's been done to date and the projection on how we're going to complete the rest of it before our deadline.
Yes.
Shannon, please.
Thank you very much. So I put together a short PowerPoint presentation. I'm not going to read every slide. You have them before you, so you're welcome to read and review them at your leisure. I just kind of wanted to hit on some of the main touch points and demonstrate the progress that the district has made toward satisfying the recommendations that were made within the performance review. So, getting the presentation queued up, but in essence, the purpose of this is to summarize the recommendations, demonstrate the progress, and track and report them to the Board of Trustees and the public. So we've made some great progress. We're about 56% of the way through the 9 total recommendations that were made in the performance review. I'll review those briefly after this quick summary. I will note that there are 4 items left, however, they are not weighted the same. Item 7, 6, and 4 should be fairly simple to address with a couple of policies. Item 2 is going to take a lot of our time and a lot of discussion amongst the trustees to satisfy that recommendation because it was very lengthy. So the first satisfied recommendation was number 1, to update the funding agreements to include Section 19 of the Special Act that was implemented both in fiscal year 23-24 and this current fiscal year in funding agreements within our community partners. So the focus is just to ensure that the district's facilities and community partners serve indigent residents. that they are Indian River County residents, and that the Board of Trustees can set rules, and the priority, however, is always that indigents have first claim to services. So happy to report that yes, this has been satisfied. It's been in the funding agreements the last 2 fiscal years and will continue to be so in perpetuity. Recommendation 3 was to adopt the Florida Records Retention Policy, which is compliant with the Florida Administrative Code. That is a high priority as it's mandatory legal compliance under Florida law. Happily, the records retention policy was adopted by the district already, and as of September 30th, 2025, all community partners were required to satisfy that recommendation as well. So that satisfaction is mostly complete. I say that because there are maybe a couple of agencies that have not been audited. So we just want to make sure those agencies get audited and confirm that that is in place prior to saying that yes, it's 100% satisfied. Recommendation 5 is to standardize the internal audit reports. That is to help create a uniform standardized template for audit reports for consistency, comparability, and accountability and financial oversight. It's a foundational step that supports other recommendations and makes the year-over-year comparisons easier. So the district compliance officer has created a standardized template for her audit reports, including reporting of agency financials and ratios as previously mentioned, and to make it simpler for the Board of Trustees to review. As far as recommendation 8 is concerned, it's to regularly report the performance review progress and agency outcomes to the Board of Trustees. This is about creating a feedback loop to ensure that we're planning, acting, measuring, and refining, always improving services for our community. It fulfills a core goal of the performance review process to ensure the district moves from planning to action and then from evidence to impact. So these action items are to collect relevant data from funded programs and report on that data, identify specific goals and objectives set by the board as a part of the performance review process, provide a concise annual summary report, and use the report to demonstrate impact. This is complete in several methods: the semi-annual agency reports, the dashboard that's on our website, the executive director's performance review report that goes out every December 1st, and these performance review presentations. Lastly, recommendation 9, the agency requirement to submit an internal audit within 180 days of that agency's fiscal year end. This is something that is a generally accepted auditing standard, and it's also accepted by the Association of International Certified Professional Accountants. This is a critical accountability measure that provides the district with verified third-party financial information, detects financial risks early, and supports their board decision-making. Timely, independent audits are a cornerstone of financial integrity and public accountability. So the action items for this were funding agreements to be updated to reflect this requirement. There's an internal tracking system that's been established to monitor audit due dates and receipt status. If the agency can't provide that audit within 180 days of their fiscal year end, they are required to submit a letter from their auditor and an expected deadline. And then there are follow-up procedures for noncompliance that have been established, for example, reminder notices and potential funding impacts based on your decisions. This is currently complete in our funding agreements and our internal tracking log. So fantastic work. So the next recommendations to address, first and foremost, is recommendation 7. We should adopt a written fiscal policy on the minimum net requirement to be reported to the board on an annual basis. This is what Mr. Kent and Ms. Carboni explained earlier. This was a policy, the reserve fund policy, that was reviewed at the recent Finance and Audit Committee meeting. Board of Trustee approval is still needed, subject hopefully in December. Additionally, recommendation number 6, the district should take steps to inform all third-party vendors providing health and medical services about the guidelines as stipulated in Section 12 of the Special Act. For this recommendation, legal counsel will help us review and advise on the action items required to fully satisfy this recommendation. And then lastly, also reviewed at the Finance and Audit Committee meeting on Tuesday, was for recommendation number 4, the internal audit policy that will also come before you in December. So just a reminder, the first 5 recommendations have been almost entirely satisfied, with 2 in progress, 1 requiring a little help from legal counsel, and that last one will likely take the last year to year and a half prior to our next performance review before we can satisfy that recommendation. So this last table just summarizes what has been completed, what's currently in progress, and what still needs to be started. If you have any questions, I'd be happy to answer.
Can you remind me, we had to submit, did you say 5 years ago?
Correct. Well, it wasn't 5 years ago, June of 2 years ago. Deadline was June for us to submit. We hired the consultant, correct.
Right, and then
Correct.
we received back from them comments, is that what?
Correct. So they gave us feedback, correct. They gave us feedback, and based on that feedback and those recommendations. No, not from the state, excuse me. This is from our consultant. So our consultant they gave us the gigantic report, and included in that was the recommendation. So we pulled those recommendations out and we're applying them.
Okay, so this was
The organization.
Because I didn't think we had ever sent anything up to Tallahassee.
Well, the consultant did, so we have an email proof receipt. Now, was it read?
We
We don't know. But what, did we do our job? Yes.
Who are they sending it to in Tallahassee? Which?
Auditor General.
The Auditor General, thank you.
And you're saying consultant, but just for the public's benefit, it was more akin to an audit or performance review.
Correct.
So it wasn't somebody that we were paying to tell us good stuff for the sake of telling us good stuff. It was somebody to help us understand what we needed to be doing differently perhaps, or whatever, so.
Correct.
And my recollection is, there really weren't any findings, problems, but the recommendations only enhanced the work, or things that might be could be looked at by others as missing. So we're filling the gap.
Correct. Exactly, yeah.
So the recommendations that they had, the state, does it provide a list of things that we needed to provide? Or was it we'll call it consultant, for better words, were they the ones that said, this is what you need to send to?
There was no, because we initially talked about that. We said, is there do we have requirements from the state? And the answer to that was no.
No.
So, right, so we don't even know, we don't even know necessarily the test questions, much less, the answers.
If I can add, Dawn and I did extensive research finding a proper consultant to do this work that had done special district performance reviews. So they had knowledge and understanding of what needed to be submitted. So it wasn't like a cold, we're just gonna open the gates and you guys give us everything. They had done performance reviews for other entities and special districts in the state of Florida.
My recollection, at any rate, that the statute creating the obligation, while it was not detailed, did have some sort of boilerplate criteria for them to look at.
Yes and no. Different districts had to comply with different parts of that statute. OPAGA is the one that manages fire, I think water, mosquito, those. So they have different requirements in this process. While hospital districts there wasn't a lot of guidance, to be completely honest with you. In that statute, it was very broad. It just said you basically need to do this report. So it was difficult when Dawn and I started this process because we had really no guidance to say, oh, this is the boiler point or this is where you should go. So there was a lot. I think it took almost a year for us to really nail down. We had many Zooms. I think we met with 6 different entities, mostly over Zoom, and we found, I can't remember their name, JBM, yeah, who was, I think you all actually chose them. We gave you the 3, I think, proposals at the end.
So then, once this is complete, then, and do we have a required time, then we have to get something up to the state? And when
Yes.
it's
Correct. 5 years, 2028.
2000.
So we have, and then,
We have a little time to do
Yeah.
those ones that we're having a little bit.
Correct.
Got it, okay. And, okay, sorry, I'm just gotta ask these questions. If it's 2028, is there any data in here that would be outdated at that point, or maybe I'm...
Well, we'll do the process all
Right,
over
right.
again.
We're going to go through this every
Yeah.
5 years. So
We'll
we're
have
going
to
to
hire
submit,
another-
we're going to
yeah.
show that we completed the recommendations that we received to be compliant, and then we're going to go through this whole process again. So every 5 years, we're going to go through this.
As I recall, this was a relatively new area,
Brand new,
5 or 6 years ago.
brand new.
And the idea was for special districts to justify their existence,
Correct.
because some people didn't realize how important some of us are. So having said that, as we prepare for performance reports, we have to have data to send up. A lot of that data is coming from our agencies. So therefore, this is a burden on us, a burden of proof on us, but it's transferred to some degree to the agencies. So I feel like we need to explain this well to the agencies so that they understand this isn't us. This is really starting at the state on their behalf to try to protect them from being taxed for things that aren't worth it. And we're establishing why it's worth it. And that takes data. Is that fair enough?
Mr. Jones, I have shared exactly what you said, as has Jenny, as has everyone in our team 100 times over the past, 2 years. Just to reinforce that what we're doing and the standards we need to uphold now for compliance are not the same as they were 5 years ago.
This process grew out of a fairly draconian effort by some in Tallahassee to trim down special districts. There were some pretty heavy statutes or bills that were being bantered about. This was, I think, a byproduct of that energy that was going on at the time.
So the good news is we're providing a lot of information. The bad news is it costs us more to have to provide all this data. So everything's a trade-off.
Indeed.
And the experts make out.
Indeed. However, Mr. Jones, you provided an amazing segue on data for me to turn to Caitlin for our updated report. We have 1 month of data for the month of October, but this is a new and improved dashboard. Shannon, thank you very much. That was excellent. And you're going to see some exciting stuff on the screen right now.
Okay, let's
We need to get out.
mitigate,
Yeah, I got to get out more. Yeah.
qualify that.
Okay. Liz, hang on. All right. So yeah, that was a great segue for me to get into all the data that we're receiving from our agencies every single month now that we are fee-for-service with everyone. So now we are getting all of the encounters from every single program, and we can track everything to a lot more detail. Rather than with the portal, we only had 5 or 6 agencies that we were doing the fee-for-service. So it was a very small picture. Now we have the entire picture of all of our agencies. So this is the new dashboard that I've created. It's a lot more pared down. It's just 2 pages, but it's going to be tracking all of the encounters for every single month as we get all the invoices, as well as the overall budget. So the first page is the encounters. It's only a dot right now because it's 1 month, but as we get more into the fiscal year, it will be a line chart that will show over the months how the visits are tracking. On the right here, we have the zip codes, and it shows where all of these people are living. This is their residency zip codes.
So the 21,841 encounters come from those areas.
Yeah, and if you wanted to, you could click on them, and it will, it's being a little bit slow, it'll filter it down and tell you exactly from each zip code.
And the larger the circle, the more people, or the darker the circle?
Yes, the larger and the darker it is, the more people there are. And so at the top, you can filter by the agency, and then there's a drop down, and then you can pick the program as well. So let me find one that has multiple programs. So if you wanted to look at Cleveland Clinic, you could look at all of it, or you could just look at the IOP. And everything is going to filter with it. The map will change, the numbers up here will change.
Go to maternity sustainability.
Yeah.
I'm not sure what that means, but
So that is the maternity agreement. We are paying them 1/12, but they are giving us all of the encounters. So this is births. So every month, we're gonna get a report of how many births.
so these are births? Okay.
Yes, yeah. So we'll have that tracking every
Do
month.
not name it births rather than maternity sustainability?
Well, I pulled the names from our, the programs on the budget so that they're matching, so that there's not gonna be any confusion over what the programs are.
I questioned that name myself when I put my report together, but it currently says,
Can change it on the budget.
Yeah.
We're changing on this.
I don't know
Yeah.
what the right caption
Yeah.
is, but.
And partners is separated out from that too. So you can narrow down to programs specifically, or you can sort by what the actual service is. I tried to categorize them as best I could. There is like an other category, because there's a couple programs that don't quite fit perfectly into one of these, and I didn't want there to be 20 different categories, so. If you want to just see behavioral health, again, the map is going to change, dental or primary care, it will filter. There is a date filter. Obviously, right now, there's only 1 month, so it's not going to be as useful, but in the future, if you did want to just look at one segment of time, you can filter that down. And then, because of how we're doing the fee-for-service, we're getting unique individual information. So for some agencies, we're getting MRNs, some agencies, we're getting names and dates of birth. I was able to take all of that and make it anonymous. I gave everyone a unique, like, random number. That way, none of the patient information is entered into this, but
So 21,841 encounters were done, were provided to 5,650
Yes.
individuals.
Right, across 59 programs over 30 days. And I'm grateful to our team and our community partners, because this was probably the biggest heavy lift we've done. The amount of work behind the scenes to develop this on behalf of our team and our partners was a lot, and we appreciate their help.
Fantastic. I
Yeah.
talked about it.
yeah, I know,
several times.
we've always wanted to know how many unique people versus
Yep.
just visits, and so finally, we're gonna have
challenge.
a good way to, it is a general, the closest we can get. Sometimes the visits are a class, so if the encounter is a class, we don't know the amount of people, but it is pretty precise generally. And so the next page is the budget. So this time I was able to pull in all of our budget information as well. So on the left here, we have all of the agencies. You can, again, drop down, you can see all of the programs. There's a column with how much they've used year-to-date, their total budget, and then what % of the budget they're currently using. And this ties into it, the goal would be at 8.3% for 1 month. That's gonna change every month.
I can stop doing my spreadsheet.
Yeah, I know, I tried to make it kind of mirror that, because I liked how it looked, but this is gonna change, green means they're either at or under their target, or red would be their over. And again, everything is gonna filter. If you click on one, all of the other charts will change. This bar chart is going to also be over time, so every month there'll be another bar. And this line here has what there would be if it was 1/12. So you can see if they were a little bit over or under, and then you'll see if it levels out month over month. So that's kind of their goal to hit, as well as the percentage.
Will we be seeing this on a monthly basis at this meeting?
Correct, so it'll be monthly, but also this will be online. So we
Yes.
wanted to present it tonight and with trustee approval. And please understand that these data have been not just verified once, twice. I mean, they've gotten crazy with this stuff. So these are good data. We'd like to post it online for access for the public, and then present it every month, so you can see the trend lines.
Yeah, and so we're making sure everything is matching up with the budget. The way that I have this working is it's taking the amount of encounters multiplied by the fee-for-service rate, and that should translate to the same as the invoice. So it's also nice because it's kind of a second set of eyes, a nice double check to make sure if I see something, the numbers aren't matching to what is on the invoice, we can go back and figure out like where's the discrepancy, if there was a typo or if it was just a missing encounter. So it is a nice also backup, double check.
Were there any elements in the prior dashboard that have been trimmed out that you think are relevant, that we should look at in some other capacity?
I'm not sure. I mean, I think the portal is still gonna be something to keep an eye on, because it's gonna kind of give us an insight into how many people are maybe losing their insurance or falling
That
off
was
of
one that was in my
Medicaid.
mind, that
Yeah.
just, we looked at, we could see the trending, we knew, you know.
So I think
why
the
things- yeah.
portal is something we should
Again,
continue, yeah.
there's different ways to look at data, though. And it probably was, that's gonna seem harsh. There was a lot in that other one. I think this really is streamlined. Feels a
Yeah.
little more accessible.
Yeah, I wanted to make it a little more simple, a little bit easier to.
But I don't want to
read,
lose
but-
some things that maybe we weren't tracking.
Yeah, I'm
You get the gist
still-
of my question.
Yeah, the original dashboard is still gonna be on the website and accessible to everyone. I'm still gonna be updating that. So all of that information, I might not be updating the visits on the old dashboard, since it's gonna
Yeah,
look
no.
entirely different. It'll be this instead. I probably will just remove that page, but the portal information will still be updated every month, and that's still gonna be,
Well, that's the one that came to my mind, and if there are others that others want to see, yeah.
yeah,
Don't duplicate. No need.
Thank you for doing this.
yeah.
Yeah, it's good, great job.
And it's early days,
I can't compete with that.
but
Color coding.
but what I noticed,
Michael,
at
step
least early days, particularly in light of all the news that's going on about healthcare demands and prices and costs, is right now, we're on a fee-for-service basis, and most of our agencies are running at a rate that is above their budgeted rate.
Yeah.
And we got to keep that in mind and follow that as we go, and we're going to find out why we need reserves,
Definitely.
or not.
Yeah. I mean, I know that we probably every couple months are gonna kind of look at everything, see where everyone's at, make sure that no one's running crazy over, making sure we're working with the agencies that, making sure they're not gonna exceed their budget, like, really, really fast, and then we'll.
Yeah, we are
fix
working
that.
closely with all our community partners, and they've been great in working with us in this to get us these data, but also the fact that we will be, truing up and every couple months seeing where we are, so we know that we're not gonna go over. I mean, it's tough because we don't have unique patients and encounters from prior years. So but next year, starting next year, we'll have this so dialed in that it's going to be very informational for the trustees, very informative. Excellent work. Thank you. Thank you, Caitlin. So I'm going to turn to impact now, and I'm going to read an impact story. And this one is about Carly, who I had the pleasure to meet a couple weeks ago at the Sunshine Physical Therapy Clinic fundraiser. In February 2023, at just 24 years old, Carly's life changed in an instant. A serious car accident left her with a traumatic brain injury and significant challenges in mobility, communication, memory, and daily functioning. After 7 months in an inpatient facility, she arrived at Sunshine Physical Therapy Clinic. At this point, she still needed intensive speech, occupational, and physical therapy. She relied on a cane, struggled with basic tasks, and often found it difficult to understand others or form sentences. Today, and when we saw her the other night, what a beautiful girl. The contrast is remarkable. Through her persistence and the coordinated support of Sunshine Physical Therapy team, Carly has regained her independence. She walks without assistance, she manages her daily routines, prepares her own meals, engages confidently in conversation, and has even re-entered the dating world. She is rebuilding her life with strength and optimism and thriving. The district is very proud to support Sunshine Physical Therapy Clinic and grateful for the opportunity to play a role in Carly's recovery. Her progress is a powerful reminder of the impact that dedicated providers and community investment can make in someone's life. And as a PT who just renewed my license in the state of California, or state of Florida, even though I don't practice anymore, I will say that Sunshine Physical Therapy and the fact that we have physical therapy, occupational therapy, and speech therapy for pediatric and adult is absolutely unheard of, who see Medicaid, who see folks who are uninsured, underinsured. It is such a gem in our community. So we're proud to support you guys.
Thank you, Frank. That's great.
Thank you. That concludes my report.
Actually, you're not quite done yet.
Okay.
I have a couple questions. I noted from your written report, what got my attention was physicians to women. I won't name it the specific physicians you mentioned, but that 98% of their deliveries go to Lawnwood. Have you reached out to that practice?
I have.
And anything developed?
I have not received a response. I mean, it's a real challenge because as we're trying to grow labor and delivery volumes in our county, and this is no surprise, but the for-profit groups are really challenging our ability to do that.
Right. So I think I made comments a month or so ago. I view this as a patient choice problem. The narrative is, as I understand it anecdotally, because we don't have a NICU, level 2 or better, this is the choice. And I think Frank last month commented that how safe labor and delivery at Cleveland Clinic truly is, and the very narrow percentages of patients that actually need that level of service. So what we're seeing is a practice that may be making decisions for other reasons. And what makes me think that is I believe this practice used to use Tradition Hospital, okay? Has a level 2 NICU, has been in the process of developing a level 3. So if that facility isn't being used by that practice, then the narrative that it's a level 2 NICU question probably is a false one. Probably, I use the word probably. I think I would like to see us aggressively doing whatever we can to direct patients. One of the ideas I have, right now I'm not suggesting we do anything specific, okay? I'm gonna make, one option would be, akin to our fee for service, is a direct grant to insured families, and the reason I'm going that direction is the indigent families are already getting support from us. We're looking for an opportunity to incentivize the use of our hospital and perhaps ramp up the conversations about why Lawnwood and not Cleveland, okay? I'm not making that recommendation, I'm just floating that test balloon. I think, Alan, your committee is gonna be addressing these sorts of things. In light of the potential that we may want to be very aggressive on this topic, I think it behooves us to get legal research on what our boundaries are. I think it's clear the Special Act gives us responsibility to address levels of service at our hospital. We've made a financial commitment. I want us to be very aggressive and robust in our approach to this situation, but I also want to make sure we don't violate federal law. The point I'm making and what I want to address, and I've actually, I called Megan last week on this topic. How safe is our hospital? How user-friendly is our hospital in the area of labor and delivery? Is there really a significant reason for us to see 98% of a practice drive to Lawnwood Hospital and the family having to schlep to Lawnwood Hospital as opposed to using our local hospital if these circumstances? So I've already kind of laid the groundwork for her to possibly address that. But when we get to other business or new business, I will be making a motion asking that we direct Jennifer to provide us with some legal direction on how vigorous we can promote our labor and delivery department and how aggressive we can be about that.
And to Paul's point, it's significant because this is two providers who see patients in our county, and 98%, to his point, of their deliveries. Now, they don't go down and deliver at Lawnwood. They send the moms down and have the laborists deliver down there. But still, it begs the question, why would they leave the county when we have such a high quality of care?
And if it's financial, they make more money with that hospital, okay, I can understand that motivation, but are you distracting your patients by making it about NICU? And in that process, removing patient choice. So now families, rather than coming to our hospital to experience the delivery of the grandchild or the baby, the nephew, niece, they're schlepping to Fort Pierce to do that. And I really want to take the bull by the horns on that, obviously.
The thing that crossed my mind,
Got my support.
the thing that crossed my mind, as you were talking, Paul, I'm flashing back to 4 months ago, in the midst of all the discussions at one of the chairman's meeting, Dr. Rothman kind of dropped the fact that I've got some news for you. Our projections for this year bumped. I don't remember, but it was a fairly significant bump. Now, if we know who they are and why they came here, it would be magnificent to hear from the horse's mouth. This is why we're here this time, or we'll stay here next time.
Right.
We can't, I'm sure, go that route, but there's data there.
Right. And I would like for us to, as safely as we can,
Yeah.
challenge the ideas that are out there. I'll put it that way.
I agree.
When is I've got it on my calendar at home, when is the ribbon cutting, the grand opening?
December 15th, I think it's 4 to 6? Or 5?
I believe it starts at 5.
5 to 7. December 15th, 5.
That's a golden opportunity for the hospital, for us, for the community, because one of the things has always been, oh, it's old, it's, my God. And I haven't been there, I haven't seen it. I mean, I'm anticipating some wonderful things. She's nodding, so it must be nice. But there's a great opportunity to build around that particular event.
Economics drives a lot of stuff, and it's dramatically involved with birthing, not only in Indian River County, but nationally. We'll go into that more at another time, but I totally agree. I don't know of any legal limits on us, but Jennifer, I look forward to hearing if there are any.
So I'll make a motion under new business to that effect, to task her with that.
Just say what your motion is. I'm sorry.
Okay.
You lost me just a little.
So there's federal,
There's gonna be a motion I want
so
to
for
know
instance,
voting on.
there's, I don't know the answer to this. There are some federal implications in promoting some practices over another and how you, right, if you're a provider. I don't think we are. I think this is safe territory for us.
Right.
But I want to be sure. And
So
also,
that we could promote the maternity, they can't, but we could.
well, they can promote it, but we can promote it a little more aggressively and differently, perhaps. So that's the point.
Thank you.
Sorry.
Okay,
Thank you.
let's move on and listen to Megan McFall, CEO of
Segue.
Healthy Start.
Another good
Good
segue.
Welcome, Megan.
Good evening, trustees. Thank you
evening.
very much. So thank you for your time, your leadership, and your steadfast commitment to this community. My name is Megan McFall, and I have the true pleasure of being the CEO of Indian River County Healthy Start Coalition. Thank you for the opportunity to share the progress that we have made over the last 6 months, progress made possible because of the investment of tax dollars to our programs. Every number that I share tonight represents a mother, a baby, a family whose future is forever changed because of the support. Behind these statistics are lives saved, crises averted, and hope restored. What is funded is not simply programs, but it is a lifeline for families in our community. Over the past 6 months, our coalition served 3,421 unique residents, 59% above what was projected, and delivered 7,558 encounters, exceeding expectations by 75%. These outcomes reflected strengthened referral networks, expanded services, and increasing community awareness of maternal and child health support programs. I would like to share some high-level statistics regarding our programs, and I'm going to start with our Babies and Beyond program. This program served 1,696 residents and increased encounters by 24%. And this was driven by expanded lactation support in our hospital program, as well as multilingual childbirth education offered in several locations along in Gifford, as well as our coalition offices. 90% of enrolled infants initiated breastfeeding, and not a single accidental sleep-related infant death occurred among participants. Now we'll go to our Grow Doula program. Demand surged in our community, serving 148% more families than projected. The program is now licensed statewide and implemented in 19 different Healthy Start coalitions within the state, positioning Indian River County as a leader in maternal child health workforce. Our maternity health navigators connected 73% more families through coordinated intake and referral, more than projected, linking them to essential supports and assisting with the PEPW applications to ensure timely Medicaid coverage and consistent prenatal and postpartum care. We most recently, this last year, implemented a maternity navigator at a caring center for women. While most programs have exceeded expectations, in true transparency, we did learn from initiatives that did not unfold as planned. Our Nurse-Family Partnership Program, though valuable, had eligibility limitations that prevented us from reaching many families who needed support and suffered state funding cuts. In response, we did expand our Babies and Beyond service line with RN case management. This new model allows us to serve a broader population across all risk levels while maintaining individualized, evidence-based care coordination, and it is already making an impact in our community. I would like to share words from a mom. In the midst of a series of unforeseen challenges, my life quickly spiraled into crisis, and despite my best efforts, I struggled to regain stability. I am profoundly grateful that my OBGYN at Cleveland Clinic recognized the urgency of my situation and connected me with the case manager at Healthy Start. Their support has been exceptional, consistently stepping in where I've fallen short, helping me stay organized and offering compassionate guidance during one of my most vulnerable times in my life. I feel truly blessed to have received such thoughtful and effective care, and I have extended my deepest thanks to the entire team for their dedication and kindness. One program that is not client-facing, but is foundational to every decision that we make in our program is the Fetal and Infant Mortality Review, also commonly known as FEMR. The hospital district supports has enabled us to examine every single infant and fetal death in our community. While this work is difficult, it is essential, and without it, we would not know where to focus our efforts. Historically, in most counties, and even in our own, we only reviewed 20 to 40% of the local deaths. That was our practice as well, until early 2024, when we decided to take a deeper look, and we looked at 100% of the cases in 2022 and 2023. This comprehensive review uncovered a critical finding, and we talked about this tonight. We found out that babies born to mothers who received prenatal care in Indian River County at a specific practice, Cleveland Clinic, and delivered at our local hospital had an 80% better neonatal mortality outcome compared to those who sought care outside of our county. This insight is already driving system-level changes. It reinforces the importance of local care and validates the collaborative efforts that are saving lives and giving babies the best possible start. Looking ahead, we envision a fully integrated maternal health system. We thank you for providing that $2 million to keep our local hospital sustainable. We believe in strong clinical partnerships, continued collaboration with maternal child health stakeholders, and robust wraparound services that influence and drive health. We're excited about the monthly collaboration. Our mission is simple, yet profound, to ensure that every mom, every father, and every baby in Indian River County has access to the highest quality, most comprehensive care available. When we talk about saving lives, it's not just theoretical. It's a newborn taking their first breath, a mom leaving the hospital alive, a family leaving the hospital with a hope and thriving. That is the impact of the support of this community. On behalf of the families that we serve, thank you for your time tonight. Thank you for your continued support. Together, we're not simply improving statistics, we're shaping futures, one family at a time.
Well, thank you very much for all you do and for the sustaining work you've done over the years, Megan. Let me just ask one question. It may be too hard, or maybe you don't answer. It's kind of interesting to me that Jeff Pickering gave a report related to the problems of infant mortality and morbidity, showing the improvement within our county, but still that there are those you're not reaching. Reason for that? Education, giving them the means of getting the Healthy Start contact, or where's the gap?
Infant mortality is decreasing, and it has. If you look at the trends, especially since 2015, when we went into partnership with Cleveland Clinic and Indian River Hospital, you'll notice a steady decline, with the exception of those COVID years. I think the statistic that you were referencing is those high-risk mothers that were not receiving prenatal care in the first trimester.
Well, my question was going to be.
Yeah, and you know, it's an access issue, to be completely honest with you. I mean, we have 1,200 deliveries to Indian River County residents with 2 OB practices. I hope that with the care that a Caring Center for Women just opened up most recently within the last year and a half, 2 years, and the support that you have provided, that we're gonna see that number coming down. They have really opened up the doors. They're offering walk-in services for women and really bridging the gap. And so I am hopeful that those numbers are going to be coming down when they do the next needs assessment. But it's an access issue.
Thank you. Yeah, difficult problem.
Yeah.
Megan, I've got a question, and it's about transportation. Are there barriers for these young ladies to get to the prenatal care?
That's a great question. I mean, we do have the Go Line system.
Of course we do, I know.
And that's very helpful, yes.
That's-
And I know you know that, obviously. You know, for Medicaid, for all 4 Medicaid companies that services Indian River County, they do offer rideshare services. You do have to ask for that in advance. For our uninsured individuals, though, there is not obviously the rideshare services. We do have a grant for if you are participating in Healthy Start services, we will provide lift share services. Transportation, though, remains an issue. You know.
Okay. I'll think.
Yeah, especially if you have 1 or 2 or 3 children.
Absolutely. I think that it's something that we need to discuss more.
Yeah.
Because I think there's ways of.
You know, 5 years, I would love to look at prenatal care going places, right?
Yes.
Looking very similar to what the VNA bus does. Martin County has a mom-mobile. Especially with as big as our county is, we need to look at something like that in the
Absolutely. There's
future.
lots of opportunities, and there's ways
Absolutely.
and means of doing it. It's just, it's figuring it out.
Yes.
And maybe that's something next on our
Yeah,
Maybe
agreed.
that's something that, Alan, you can put on your list of things to talk about, and I would
I'd
love to
love
be
to.
involved with that part of it. because
Absolutely.
I
I'd
have
love
some
to talk to
ideas.
you about it. We talked briefly
Yeah.
at a public meeting about it, but we, of course, could not be any other way that we could talk about it. But I don't know how we could, there ought to be a way with Uber or Lyft or some of these ride-sharing capabilities to get
Well, through Community
others
Coach, we could
direct.
probably manage something.
Okay.
Yeah.
Got many buses out there on a daily basis, and I don't know what it costs to do the Uber and Lyft. They're not cheap anymore.
No, they're not.
And,
Well, but CareNet and the Caring Center for Women do provide some service to help get them there.
Right.
So that's one of the things, I totally agree with that. I'd love to talk with you about it.
When you look at, though, throughout the United States and the counties that have the best access to, or the best outcomes for first trimester care, it is you going to the women, right? So it is prenatal care buses going to, just parking a bus in those areas that have
Like a mobile bus, so
yeah,
like the
struggles with
mobile-
transportation, like taking a bus and going to Fellsmere for a day, going to South County, going to
So are there
Sebastian for a
actual
day.
mobile buses that are designed for
Yes.
prenatal?
Yes,
Don't we have one that's just sitting?
Yes.
Yeah.
Could that be the
Could that be,
something else?
could that be some
Perhaps.
part of it? There, put that on your list too, Alan.
if there's a mobile bus that's just sitting around in the community,
Yes.
where?
I'm
Sign
gonna
us up.
show great ignorance
Talk offline.
Okay,
Yeah, right.
all right.
here. Can a woman get through her first trimester without knowing she's pregnant?
There's always those,
They-
yes,
It's gonna be a
yes.
small
without knowing.
percentage. I was thinking about the 30, that,
Yes.
that keyed me when Jeff was making his presentation.
Yes,
That first trimester is so critical, and then, is that possible? So,
absolutely.
but it's not a large segment of those.
Yeah, my daughter-in-law just went through without the slightest hint of morning sickness.
It's possible.
Yeah.
Yeah, she's very lucky.
So I called Megan last week when I realized she was going to be here, and my wheels were turning, and I kind of went through some very specific sorts of things. I'm just going to give you an open-ended opportunity. How safe is our labor and delivery department, number one? Number two, the quality of the experience there. If you could talk, because you're there, your people are around there, what is that like? I want
Sure.
to, every opportunity we can crow about it, we're going to crow. Go ahead.
Sure. First of all, Caitlin, you speak my language, and I love data, and I'll just speak data, right? Because anybody who would hear me say this would say, of course, you're biased to that. I worked there for 17 years. I ran that department for 7 of those 17 years. But the data will tell you that it's a very safe department. Now, they do not have a NICU. So many women do leave the county because they do want to go ahead and deliver. They don't want to take that chance. And at Cleveland Clinic Indian River Hospital, the babies transferred out of that hospital are less than 2%. And that is because we're very blessed in this community to have maternal fetal medicine here locally at Cleveland Clinic at Partners in Women's Health. So if you do get prenatal care and you are deemed to be needing to see high risk and you are following their recommendations and you're seeing maternal fetal medicine and they deem you to not be safe enough to deliver at a level 1 facility that Cleveland Clinic Indian River Hospital is, they will set you up for success and deliver at a level 2 or a level 3. And so if you are a candidate to deliver at a level 1 facility, such as Cleveland Clinic Indian River Hospital, the likelihood of you being separated from your baby is less than 2%. I will go through the stat again that I quickly went through in my presentation. One of the things that we do at Healthy Start is the fetal and infant mortality review, which means that we look at every single fetal and infant death within our community. Again, very sad. we have the opportunity to get every death certificate. We then we get all of the medical records, and we look at the death from the moment that the mom is pregnant until there was the death. And we look at the present and contributing factors. We're able to see, where did the mom get prenatal care? Where did the mom deliver? Was there housing insecurities? Was there a substance use disorder? All of these present and contributing factors. When we peel back those onion layers, and I personally, as a registered nurse, looked at every single one of those deaths, we are able to see from 2022 and 2023, if you sought care at Cleveland Clinic Indian River Practice, Partners in Women's Health, your neonatal mortality rate, meaning that your baby didn't die before 28 days, was 0.81. The Florida average is 3.95.
That's per 1,000.
That's per 1,000, thank you. The Florida average is 3.95. If you delivered at Cleveland Clinic Indian River Hospital, your neonatal mortality rate is 0.80. Those are pretty good odds. So when you talk about safety versus to your north or to your south that both have NICUs, your odds are pretty good.
And I inferred from some of your comments, if you require a NICU, more than likely you know it before you're driving to the hospital for the delivery.
Yes, if you're receiving proper prenatal care, yes.
Thank you.
Did you comment if you know where Cleveland Clinic Indian River Hospital Foundation is going with this? They have a new budget of raising $40 million, and my understanding is their maternity, in part because the district did it not only in 2018 when it started Partners, but now pushing the importance of maternity is getting people's attention and financial attention. Do you know any insight on that?
I don't.
Okay. I think something's happening. So
That
we'll
would be wonderful. I mean, I know that they're finishing the renovations that was, a capital campaign started well before COVID. I was part of that capital campaign. And they are finishing the renovations of labor and delivery and the postpartum unit. That will be unveiled December 15th. And that's very exciting. And I am hopeful that once that is done, that will capture some of the women who have chosen to deliver outside just because of aesthetics, right? I've said for many, many years, women's brains are wired very differently. We think that pretty equals good. And so if we walk into a very outdated labor and delivery department, and the statistics are not evident to us, we're going to choose to go somewhere that is prettier. And so I am hopeful that this renovation will help capture, along with a lot of, there's been a lot of buzz and a lot of discussion and a lot of social media. I know that Dr. Rothman just did an interview that has been on social media where he talked about the statistic that I just quoted. So that is getting out, and that's wonderful. I know that I have heard in conversation that there is discussion about moving Cleveland Clinic Indian River Hospital to a level 2 in the future. So that's exciting to hear. It's needed. Even though there's less than a 2%, right? You'd be able to capture those moms that do need to deliver at a higher level facility. OB is a mission-driven service line unless you have a NICU attached to it.
Okay, great. Any other questions or comments? Thank you.
Thank you.
Thank you, Megan.
Thank you.
Okay, unfinished business.
I've got probably maybe the faster item. I'm going to request a motion to approve and adopt the 2025 amended and restated bylaws of Indian River County Hospital District Board of Trustees.
So moved.
Second.
All in
Is there
favor?
Further discussion?
Oh, sorry.
Well, and for those in the public, these have been aired out 2 or 3 times, and again, yesterday pretty thoroughly, so.
Yes, per the prior report, that is all accurate. We did discuss these quite a bit, and they've been before the board multiple times now, so it's just a formality at this point to adopt them.
It's, to my view, is a very important document to read. I think, I wish I had read it a year ago. Learn more about what the activities, something which Paul has mentioned, the potential activities that the district has with respect to healthcare within our county. And further discussion of the bylaws, I think, will be of interest as we move forward in that direction.
Do you want to call for public comment on this before you adopt them?
Yes, please, is there any public comment related to the restated bylaws which have been discussed at our chairman's meetings and tweaked until a final draft, which is present, actually not a draft, a final document, which is present here today? Anyone? Okay, let me call for a motion to approve the restated bylaws of the Indian River County Hospital District.
We already did.
For a vote, call for a vote.
Yeah,
We-
for a vote.
Aye.
All those in favor?
Aye.
Aye.
Any opposed? Motion carries. Thank you very much
Thanks, Jan.
for your work on that. Okay, new business.
All right, I have two items, actually, one I've already talked about, I'll go ahead and just make the motion. I move that we direct Jennifer Peschke to research the boundaries for the hospital district to lawfully promote our labor and delivery department at our community hospital.
Second.
Would you provide any further discussion or direction or funding of that,
Well,
or is she just going to do that? Asking-
we usually, when we give her direction to render legal opinion, we don't attach dollars to it. That's why I just did the motion the way I did.
Let's see what we can do.
Okay, is there any further discussion related to that motion which has been seconded? All those in favor say aye.
Aye.
Opposed?
The second item may be disturbing for some. I'm not asking that we consider selling the 10th Street property, okay? But in light of the presentations yesterday, I think it behooves us to engage a broker, a real estate broker, because the potential sale of that property inevitably may be part of an agreement with one or more of the LOIs. Additionally, I think that we ought to give serious consideration to option 5 of selling the property outright, depending on how we view the need, how we look at any supported data supporting the specific requests that we've made. So I'm not asking that we, because we've got, the process would also involve us declaring a excess property, but I'm just looking that let's have I'm going to make the motion, but have a broker come alongside of us to speak into this process as we move forward. So that's the explanation. Here's the motion. I move that we direct staff to engage a real estate broker, appropriate real estate broker, to assist us in the analysis of the potential sale of the 10th Street property.
Is there a second for the motion? I will second it. I think it behooves us to learn as much as we can about potential value of that property, and as the 2 different or 3 different groups come forward, we will know more about it.
We do have an appraisal, but it's a little bit dated. And I think rather than having, I say a little bit dated, it's over a year old. Rather than hiring somebody to do an actual appraisal, we may get information, current market situation, how we might approach a lease option in conjunction with helping Jennifer. There are multiple ways I think that we would be able to use the services of a broker in this process at this stage. That's what's going on in my mind.
I see what you're saying now. I just want to be sure we did a letter of intent and there's a process in place for what we're doing, that throwing this into it is not going to muck the waters up at all. I know, we need to have further discussion about, I have a concern more than value of the property. Mine is the zoning, and that I think that we need to talk more about if there is well, not both, there was one that would need the zoning changed. Another one potentially down the road might need a zoning change, and I think we need to have further discussion on that.
I'm not necessarily opposed to the information you want to get. In my mind, it's kind of a timing thing, having just really chewed on it yesterday, nominally, and knowing that at our December chairman's meeting, it's going to be a key item that we're going to really get into the nuts and bolts. I'd kind of like to take that next step, and it'll help me read where other people are, number one, and give me a chance to voice a couple of concerns. Everybody's got concerns. So I get it, and I think that in the end, we may do that, but I'm feeling like it might be slightly premature.
Yeah.
That's where my head is.
I wanted to also say, I'm interested in understanding what the plans are. How are we going to go through this process? I understand, Karen, you've been asked to, Chairman Cooney asked you to provide a summary of the proposals based on what we heard. I'm not clear on, okay, so we get a summary, so then what happens?
Right.
And so I too am concerned that it's premature. I understand what you're saying. I don't disagree with it, but I need to know the whole picture before we start with some tactics.
Yes, thank you, Carrie. The reason I support it is because in reviewing the proposals and talking to them, both, at least the two leading groups, suggested that,
We don't have leading groups.
Yeah.
We've never had any discussion.
We've not had any.
I haven't anyhow.
well, we had four presentations.
Four presentations.
Of those four presentations, my belief is two of those stood out among the four. And both of those groups suggested they were in the process of considering buying the property sometime in the future. So the more we can learn from a legal standpoint,
Well, we
in
have
real
to
estate-
review all four of them.
Right.
We will.
Which is
Well.
what the intention is at
And-
the
Yes.
next chairman's meeting.
And Karen, I agree, the zoning issue is a significant topic for conversation. But I think that's separate and distinct, and also it may actually beg the question is, what sort of expertise do we have to assess the lay of the land as we're moving forward? And in my view, the sooner we have the input, the better, as we're looking at the options. So that's it. Just some,
I guess what could it hurt, having a broker, where it's not costing us anything, having a broker give us an idea of what the value of the property is now?
Yep.
And it's just more information.
that,
Marketing analysis, you're right.
Exactly.
Well, you're right. I'll vote yes on that one.
now we're signing a contract or
No,
anything like that.
no, not at all. I don't have a
And
problem.
so there's no cost to asking a broker to do a market analysis?
Is it brokered? Yeah, we have some options.
okay, any other comment? Okay, I'll call the question. All those in favor of the motion as presented, say aye.
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 Opposed? Motion carries.
Won me over.
Okay, any other business to bring before our Board of
Yes,
Trustees? Yes.
My theme for the meeting today is, so we talked about the grants yesterday. We all appreciated the report from Jordan. Am I right?
Jordan, yeah.
Jordan, thank you, geez. And I want to make sure that the trustees have an opportunity to speak into guardrails. I know we're all interested in, I heard some interest from other trustees in moving forward, but there were some concerns I saw in some of the organizations that she had brought forward in her report. And so I'd like to make sure before we move forward with her that we have, trustees have discussion. So if we can put that on December agenda, that would be great.
That would be fine, sure. Okay. Is there any public comment related to the proceedings today? Please come forward and identify yourself.
Hi, everyone. I'm Ginny Blossom. I'm the Executive Director at Sunshine Physical Therapy Clinic.
Welcome, Ginny.
First, thank you, Frank, for telling Carly's story. I myself was a high-risk mom, and I had a fabulous experience at Cleveland Clinic Indian River Medical Center, so I just throw that out there. But I wanted to comment on a statistic from the needs assessment that was presented by Mr. Pickering today, that 44% of children in our county are unprepared for kindergarten. Many of those don't have the fundamental skills to succeed in school. And that is one of the things that Sunshine does to prepare these kids to succeed. In fact, there's a statistic that 42% of children who received the kinds of services that we provide between the ages of 0 and 5 will never need therapy in school. And that's a staggering number. Our area right now of need for our pediatric program is growing primarily in South County. 45% of our current and waitlisted kids are from that area. So I would like to thank all of you for encouraging collaboration. I'd like to thank you for supporting Sunshine, and I'd like to thank TCCH for their partnership in the collaboration of our satellite clinic at their Oslo Pediatric Clinic when it opens at the end of 2026. So just sharing that, we're going to be able to see 200 more children to help them into the school system through that partnership. So thank you.
Any insights into why South County?
No. I could dig into it, though, and I'd be
I'm
happy
just
to
curious,
provide
yeah.
more. It may have to do with affordability of housing. It may have to do with any.
But there, we've got other pockets that are so similar. It's just
Yeah.
interesting why South County.
Yeah, exactly. So, thank you.
Ginny, thanks very much and for what you do. Any other public comment? Checking online, there are none. I will call for adjournment of this meeting.
Thank you.
Thank you all for participating.
Have a nice Thanksgiving, everybody.
Have a nice Thanksgiving.
It's Thanksgiving.
Around the corner.
I know.